Hi, my name is Simone Shaw. This presentation is done in partial fulfillment of the course Financial Management in Healthcare Environment. Today we're going to be discussing capital finance in healthcare. Financial management provides the framework and tools that are needed to assist healthcare managers and or leaders to make good financial decisions. The objectives are provide the overview of a healthcare organization major fund investment, discuss the purpose of capital finance, explore the importance of quality access and sustainability, and to give a summary of two recommendations on how to finance operations. Following implementation, leaders evaluate capital projects through post-implementation review, assess quality matrices, operational efficiency, financial performance. These findings inform future capital planning decisions, reinforce a culture of accountability, transparency, and continuous improvement. One of the most significant capital investment undertaken by HSHS St. Mary's Hospital in Decatur, Illinois is the ongoing $90 million modernization project of his hospital facility. At HSHS St. Mary's Hospital, capital finance is a strategic leadership responsibility that enables alignment among the Catholic mission, community health needs, and long-term financial sustainability. Capital resources enable us to maintain safe facilities, replace aging equipment, and invest in technology that support patient safety and clinical excellence. As an executive team, we should view capital not as discretionary spending, but as an essential investment in care quality, workforce efficiency or effectiveness, and regulatory readiness. Capital budgeting process. First, there is identification of capital needs, evaluating using financial matrices such as the IRO, return on investment, and NPV, net present value, approval and prioritization, and then finally you have the implementation and monitoring. Capital requests at HSHS St. Mary's are evaluating using financial and clinical criteria matrices such as the return on investment and cost avoidance weighed alongside patient safety, regulatory compliance, and quality improvement impact. System-level governance ensures scarce capital dollars are allocated to projects that deliver greater value to patients, safety, and caregivers alike. Challenges in healthcare capital finance. High capital costs, regulatory and reimbursement uncertainty, balancing mission and financial returns, and dealing with outdated technology or infrastructure. According to Zillman et al. 2020, organizations must balance aging infrastructure needs, technology investment, and workforce demands while maintaining financial stability and aligning capital decisions with quality, safety, and long-term strategic goals. Capital finance and the impact on quality and patient care. It supports patient safety and outcomes. It improves efficiency and throughputs. It enhances workforce satisfaction. It enables long-term organization viability. Capital investment directly supports quality care and improved throughputs, reducing staff workload and meeting the center of Medicare and Medicaid requirement. Investment in electronic healthcare records, optimization of imaging technology, and infection prevention infrastructure have measurable impacts on patient outcome, staff retention, and reimbursement performance. One of the most significant characteristics of healthcare organization is its financial condition. By determining the financial condition of the healthcare organization, the leader will be better able to position the organization for financial growth. Two recommendations on how to finance operation. Firstly, operation indicator analysis, which focuses on operation data with the goal of explaining financial performance. Secondly, financial statement analysis, concentrating on information in an operational finance statement with the goal of evaluating and valuing the financial condition. Another strategy that could be used is the economic value added analysis that focuses on evaluating and assessing managerial performance. The operating indicator analysis is what I would call a risk management tool that investigates internal data to clarify the factors that contribute to financial statement of the organization. These indicators are employed by leadership to identify and guide financial strategies for the future to improve condition and status of the health organization. Ratio analysis. This includes both operation indicator analysis and the financial statement analysis. According to Gabinski and Pink, 2015, the ratio analysis is a method used in both the operating indicator analysis and the financial statement analysis. It combines values from both the financial statement and the operating indicator analysis to generate a single figure that possesses easy, interpretable economic significance that can facilitate and simplify comparison. Operating indicator analysis focuses on key performance measures such as operating margin, day cash on hand, average length of stay, occupancy rate, labor expenses as per percentage of revenue, and cost of adjusted discharge. For HSHS St. Mary's Hospital, close monitoring of labor productivity indicator is essential as workforce cost remains the largest expense driven in healthcare or hospital nationwide. Improving staffing efficiency through equity-based scheduling, reduce overtime, targeting retention strategy, and stabilizing operation margin without compromising quality healthcare. Zillman et al. 2020 explained that improving throughput by reducing length of stay and avoidable delays can increase capacity utilization and revenue generation without significant delays of capital outlay. Financial statement analysis complements this by evaluating liquidity, solvency, and profitability through ratios such as the current ratio, debt service coverage ratio, and operating margins. Given the ongoing pressure from Medicaid and Medicare under reimbursement, St. Mary's Hospital should prioritize financial operations through internal cash flow and system level support rather than new debt when possible. Maintaining adequate day cash on hand is critical to absorb reimbursement delays and unexpected expense surges. Hoffman Hall 2024 explains that strengthening revenue cycle performance through improving documentation, coding accuracy, and denial management can enhance net patient revenue and reduce reliance on external finance. Financial statement analysis is a review of the organization's statement to assess financial health, performance, and decision-making capacity. For example, a hospital review is balance sheet and income statement to evaluate liquidity and operating margins. Horizontal analysis compares financial data over time to identify trends. For example, a hospital compares operating expense from year 2022 to 2024 to assess cost growth. Vertical analysis examines financial statement as a percentage of base figure. For example, labor costs may be analyzed as a percentage of total operating expense. Ratio analysis evaluates relationship between financial variables. For example, a current ratio assesses short-term liquidity while an operating margin measures profitability. Earning power reflects the organization's ability to generate sustainable profit from core operating margins. And then last but not least, we have the irregular items or unusual, non-recurring event such as disaster, related expense, or one-time asset sales. In summary, capital finance in healthcare refers to how the organization obtain and manage long-term funds to support buildings, major equipments, technology, and strategic growth. It includes balancing debt, equity, and reserve while considering reimbursement uncertainty, regulatory requirements, and the need to maintain quality, safe, and financial sustainability. Based on these analyses, a recommended financial strategy includes optimizing operational performance to generate sustainable cash flow, leveraging healthcare system pooling for short-term liquidity needs, and reserving debt finance for high-impact investment that improves quality efficiency or regulatory compliance. This balanced approach supports financial stability while preserving the hospital mission to deliver high-quality patient-centered care to the community it serves. These are my references. Thank you for listening.